Welcome to the Farm Show with our guest, Metformin. You all know what time it is. Here's your host, Polly Pharmacy.
Thank you, everyone, and welcome to tonight's episode of the Farm Show, where we go in depth to discover medicine's true nature. Please help me welcome our guest tonight, Metformin.
Woo! Yeah, Metformin!
Welcome to the show, Metformin.
Thanks for having me, Polly. I'm really super duper excited to be here.
Okay, calm down. We are glad for you to be here, too. Is it okay if I call you Metformin, or do you prefer to be called
Glucophage.
Okay.
Metformin is fine, Polly. We are friends, after all.
Oh, Thanks, Metformin. You're so sweet. You're giving me a sugar rush. So how's your family?
Well, for anti-diabetic drugs, there is a huge extended family. But I'm the only biguanamide.
I didn't realize that. So how are you different from any other anti-diabetic drugs then?
Well, the difference is my mechanism of action. I lower blood glucose and improve glucose tolerance in 3 ways. First, I inhibit glucose production by the liver. Then I slightly reduce glucose absorption. Lastly, I sensitize insulin receptors to increase cellular uptake of glucose in response to available insulin. I do not like to stimulate the release of insulin like other anti-diabetic drugs. I won't mention names, but sulfonylureas. Therefore, my patients don't experience an added risk for hypoglycemia or low blood sugar.
That is good to know. So how are you made available for patients?
Oh, well, you see, sugar, I am ingested orally either in tablet or solution form. Since I am not metabolized, I am absorbed in the intestine and then excreted unchanged by the kidneys. For this reason alone, people with renal impairment should be careful with my usage, since I can build up to toxic levels.
It's hard to believe that someone as sweet as you can have such bad side effects.
Polly, you're such a doll. Thank you.
So why don't you explain to the viewers what you were used for?
Hi, viewers. I used to help people with type 2 diabetes. Glycemic control is my main use. I lower basal and postprandial blood glucose levels. I can be combined with sulfonylureas to lower blood sugar even more effectively than I can do solo. I also have recently been used to help prevent type 2 diabetes in high-risk individuals as a treatment for gestational diabetes. And although I am not approved for it, I can also be used to help treat polycystic ovary syndrome.
Amazing.
Oh, Polly, you're gonna make me blush.
Well, I know you said that you had a lower risk than other drugs in the anti-diabetic family, but what side effects and contraindications do you have?
Well, Polly, the common side effects of my usage are decreased appetite, nausea, and diarrhea. Ugh. These usually subside in time, but in 3 to 5% of patients, they lead to a discontinuation of my use. I also decrease the absorption of vitamin B12 and folic acid, which can cause deficiencies, and I am contraindicated for people with failing hearts. My patients should also avoid alcohol because it inhibits the breakdown of lactic acid, which I already do as well. When I inhibit lactic acid oxidation, I can cause lactic acidosis, which is an emergency medical situation.
Oh my goodness.
Fortunately, this is rare, Polly. About 3 cases for every 100,000 patient years, when I am used at recommended doses in patients with good renal function.
Oh, thank goodness. So what you are saying is that people use you like they are supposed to and avoid alcohol. You can help them in preventing controlling type 2 diabetes.
That's correct, Polly.
Oh, Metformin, you are a very useful drug. Thank you for coming on the show this week.
Thanks for having me, Polly. It was truly a saccharine experience.
This has been the Farm Show, brought to you by Team Ramrod.